All right, let's jump right into this one. Today, we're looking at a really fascinating case study. We're going to see exactly how the Department of Health and Human Services, HHS, solved an absolutely massive bureaucratic bottleneck, and they did it using some incredibly smart tech. So, in this explainer, we're unpacking a real-world transformation that sits right at the intersection of national security and, well, massive-scale government efficiency. Let's get into it.
So I want to start with a question, and it's a bit of a provocative one. How do you securely ID-proof 80,000 remote employees? Just think about the sheer logistical nightmare of that for a second. You've got this massive, highly distributed workforce, and they all require strict security clearance. So how do you verify exactly who they are without, grinding daily operations to a complete standstill?
80,000. Seriously, let that number sink in. It's crucial to remember here that we aren't talking about some nimble little tech startup scaling up operations. No, this is a critical government operation with massive stakes. Verifying the identity of 80,000 unique individuals across the country, that is a monumental, incredibly complex task.
And, these aren't just any everyday employees either. These are folks working for essential public service agencies. We're talking the FDA, the CDC, the NIH, and the Centers for Medicare and Medicaid Services. Secure access for these specific workers directly impacts the critical services that millions of Americans rely on every single day. So the margin for error? It's essentially zero.
Now, this comparison perfectly illustrates the severe friction of the old way of doing things. The traditional, centralized approach meant relying on just a few physical facilities. Just imagine the absolute pain, not to mention the expense, of forcing an employee to literally fly all the way from Alaska down to San Francisco just to sit in a waiting room and prove who they are. Now, contrast that staggering inefficiency with the reality of today's modern, decentralized workforce. They desperately need rapid, local onboarding, not cross-country flights.
And then, as we all know, the world completely changed. The COVID-19 pandemic acted as this massive agitator. It took that clunky, super expensive, in-person process and made it practically impossible overnight. With the remote workforce suddenly skyrocketing, a process that was, frankly, already heavily strained was suddenly completely unworkable. They were forced to make a critical pivot, and fast. Adam McBride, who's a program manager over at HHS, really grounded this massive technological challenge in a relatable human perspective. He said, how do you create high-assurance credentials without in-person identity proofing? That was the ultimate puzzle right there. They absolutely needed top-tier security, but they simply couldn't do it face-to-face anymore.
Section 1. The NextgenID Solution. Enabling decentralized and remote enrollment. Let's look at how shifting to a decentralized approach became the ultimate answer to HHS's credentialing crisis.
Okay, so the crucial point here is wrapping our heads around this acronym, SRIP. It stands for Secure Remote Identity Proofing. And it's exactly what it sounds like. It's a software and process framework that allows organizations to verify identities remotely, all while strictly adhering to rigorous security standards. SRIP is basically the foundational engine that actually makes decentralized government credentialing a reality.
So how does this actually build a complete frictionless ecosystem? Well, NextgenID came in and provided a complete American-made solution that combined both the physical kiosks and the software, all built on top of strict security best practices. Plus, they offered flexible, transaction-based pricing, which, if you know anything about managing government budgets, is huge. But honestly, here's the best part. Because it's a complete managed service, HHS literally just provides the floor space and the power outlet, and NextgenID handles all the hardware maintenance.
And McBride actually validates exactly why they chose this specific route. He notes, NextgenID gave us the option to use their SRIP software with our own enrollment staff, which was more practical and cost-effective for us. This just beautifully showcases the flexibility of the whole system. Instead of being locked into some costly third-party credentialing service, HHS could actually empower their own staff to handle it securely in-house.
Now, the speed of deployment here is just remarkable. They kicked things off with a tight 3-site pilot just to refine the user experience. Well, it was so successful that when a sudden need to enroll 40,000 people hit, they were able to rapidly move into full production mode. From there, they expanded to 15 federal locations, keeping a future goal of up to 90 nationwide sites in their sites. It's honestly a textbook example of incredible scalability and getting an immediate return on investment.
And here is a really brilliant innovation, the concept of multi-tenancy.
To maximize efficiency, these kiosks aren't just locked down to a single agency. No, they can actually be shared by any federal, state, local, or tribal entity. Backed by the PresenceID nationwide network, this totally shattered those old agency silos and suddenly made enrollment incredibly convenient across the entire country.
Section 2. Results and Transformation. Eliminating friction and slashing costs. Let's dig into the hard numbers and see the massive contrast between the old way of doing things and this new reality.
So the new user experience, it is ridiculously easy. Step 1, you find the nearest kiosk. Step 2, you scan a unique QR code. Step 3, you complete the self-service process in about 5 to 10 minutes. And that is literally it. We went from booking cross-country flights and sitting around in waiting rooms for hours to a simple, localized 10-minute drop-in. The speed is just phenomenal. To really reinforce that new reality, Mohab Murar, the president and CEO of NextgenID, sums it up perfectly. He points out that users just find the closest location, scan a provided QR code, and they are literally in and out in 5 to 10 minutes. It completely cements how successful this transformation has been, finally marrying high-level national security with everyday common-sense convenience.
So let's talk about the measurable business outcomes. First off, they completely eliminated those massive travel and lodging costs. Bypassing those expensive flights saves millions in turnover and contractor fees right off the bat. Plus, they reclaimed thousands of hours of lost productivity, which means way faster onboarding for new hires. And think about the resilience this adds. If someone misses an appointment now, you don't eat the cost of a non-refundable flight, you literally just generate a new QR code for a local kiosk. It's a game changer.
Section 3. Future Opportunities. Expanding the NextgenID footprint. Because, this isn't just a static one-off fix, it's an evolving partnership that's specifically designed to future-proof HHS operations.
We are finally moving completely away from that big, bulky mess of legacy government-issued equipment. Instead, the future is all about these sleek, compact, and rugged mobile enrollment kits. These kits literally fit in a case and are capable of enrolling hundreds of people, pretty much anywhere. It just beautifully illustrates how remote enrollment can now happen directly in the field, taking the solution straight to the user, wherever they are.
On top of that, HHS is already looking at expanding the kiosk's utility to handle self-service credential activation. What this means is they'll be using the machines to actually bind the secure credentials directly to a user's PIV card. That's their Personal Identity Verification Smart Card. By utilizing their existing staff and those widespread locations, they are squeezing even more value and return on investment out of the hardware they've already deployed.
Which leaves us with this final provocative thought to wrap up our explainer today. Is your organization still flying employees across the country just to prove who they are? It's a powerful challenge to really rethink those clunky legacy credentialing systems. The technology exists today to secure modern workforce identities safely, affordably, and rapidly. Thanks so much for joining me to explore this case study, and I really hope it sparks some innovative ideas for your own operations.